I'm hearing a little bit of echo. If someone could just mute until this time. All right, let's get started. Thank you for joining us today for a discussion on how multi-sector partnerships can advance racial equity through a housing campaign. I'll be moderating the discussion today. My name is Chantel Wilkinson. I am the campaign manager of Opportunity Starts at Home. If you're unfamiliar with the campaign, we work to bring diverse voices into the housing space to advocate for affordable housing. I'll introduce the panelists in just a minute, but before we get into that, I want to give a short introduction on our racial equity working group and the work that we've done so far. The campaign's racial equity working group meets monthly, executing an action plan to amplify racial equity throughout the campaign. It was abundantly clear during our initial discussion that racial inequities in housing cause and exacerbate racial disparities in other sectors. When parents cannot afford rent, that means that they cut back on educational materials for their kids, nutritious foods, medicine, and more. Poor housing conditions is linked to long-term health problems, such as kids experiencing asthma due to dilapidated housing. Neighborhoods located near harmful environmental factors, such as waste disposal and toxic dumping, cause tremendous harm to the overall well-being of people living in these neighborhoods. There are many examples we can draw from, but the bottom line is that housing has spillover impacts, and we know that decades of structural racism found in housing affordability, segregation, quality, homelessness, wealth building, have facilitated an impact that spills over and is felt by Black and Brown people. Through the campaign, our policy agenda can help advance greater racial equity in housing, which will help promote greater racial equity in other sectors. To date, through the work of the Racial Equity Working Group, we have updated our vision, mission, and goal statements to better reflect racial equity, released podcasts to explore the work of the Racial Equity Working Group, released fact sheets on the campaign's website around racial inequities in housing, updated the campaign's policy agenda to explain how the campaign's top housing policy priorities will advance racial equity, and released a number of issue briefs meant to deepen our understanding of racist housing policies and its impact on other sectors. In just a minute, I'll drop many of those resources into the chat box so that you can take a look. And now onto our discussion this afternoon. It's my pleasure to introduce some of the campaign's long-standing partners and members of the Racial Equity Working Group. Curtis Johnson, Vice President of Housing Strategy at Catholic Charities USA. Alexandra Ashbrook, Director of Root Causes and Specific Population at Food Research and Action Center. Charlotte Bruce, Research and Policy Analyst at Children's Health Watch. So my first question to you all is that your organizations have been close partners to the campaign since the launch in 2018. Can you tell us more about your organizations and why you participate in the Opportunity Starts at Home campaign? And I'm looking at Curtis, so I'll have you jump in first.
Thanks, Chantel. And again, my name is Curtis Johnson. I'm Vice President of Housing Strategy at Catholic Charities USA, and I'm happy to be here today. The mission of Catholic Charities USA is to provide service to people in need, to advocate for justice and social structures, and to call the entire church and other people of goodwill to do the same. At Catholic Charities, we help people regardless of their faith who are struggling with poverty and other complex issues. At CCUSA, we support the member agencies in our network to provide help and hope to our neighbors across the country. Our collective efforts focus on a set of strategic priorities that make a difference in the lives of the people in need. CCUSA has a long history of creating and operating affordable housing opportunities, and in 2016, affordable housing became one of CCUSA's priority areas. CCUSA created a housing community of practice where its members could network and convene and formulate strategies to focus on production and preservation, i.e. the development of new affordable housing projects and units, and the refinance and rehabilitation of the network's current 31,000 plus unit portfolio. Our president and CEO, Sister Donna Marker, made a decision to accept the opportunity to start at home campaign steering committee member role, not only so we could learn from others, like my fellow panelists here, but also contribute towards solutions, i.e. advocating for more resources to address the affordable housing crisis that we all deal with. Moreover, also to ensure that the most vulnerable of those, i.e. those with the households with the lowest incomes, receive adequate affordable housing opportunities. CCUSA recognizes the influence, perspective, and value of other sectors can bring to affordable housing and its cause, be it education, prison reform, healthcare, social services, disaster. These are all areas that impact or are impacted by affordable housing, particularly the lack thereof. So in that way, this Opportunities Starts at Home campaign fit neatly into the ideas and strategies of Catholic Charities USA. I'll stop there.
Thanks, Curtis. I'll move on to Alex.
Chantel, thanks so much for inviting me to be part of this engaging conversation. And I'm excited to hear what Charlotte and Curtis have to say as we delve into this issue. So joining Opportunities Starts at Home was a natural fit for our work at the Food Research and Action Center. We're known affectionately as FRAC. And FRAC obviously works to end hunger in America and improve the nutrition, health, and well-being of people struggling against poverty-related hunger. And we do so through advocacy, partnerships, and by advancing bold and equitable policy solutions. So a crucial strategy to end hunger in America is to really leverage the federal nutrition programs, which have a long list of research publications that tout their benefits to addressing food insecurity, but also improving people's health, nutrition, and well-being. And those programs include SNAP, Supplemental Nutrition Assistance Program, long ago called food stamps, school meals, WIC, after-school meals, older adult food programs. These are all critical programs to address hunger. And the improvements that were made to these programs during COVID-19 really helped mitigate food insecurity in America, along with the economic investments from the federal government. But we also know, as fabulous as the programs are, they can't end hunger alone. And clearly a key piece that drives hunger in America is the need to address root causes and racial inequities. So, FRAC looks at addressing root causes that include jobs that don't pay adequate wages, that don't have adequate supports. They have a lack of access to affordable childcare or unreliable hours, not sufficient job training. Other root causes are an inadequate safety net. And then, of course, a key root cause that drives hunger is lack of access to affordable housing. So we were really delighted to be part of this coalition where we can delve into what are the policies we need to improve the housing crisis in this country, and how can we leverage those policies to help the people who are most disproportionately harmed by our long and ongoing history of housing discrimination and segregation in America. So that's one of the many reasons we joined the Opportunity Starts at Home campaign. And we've been delighted to leverage our network of advocates across the country to do more on housing policy.
Thanks, Alex. Charlotte?
Hi, everyone, and I'll echo Alex and Curtis with the thanks for being here and excited to talk to you all today and be on this panel. So as Chantel said, I'm Charlotte Bruce, and I'm the Research and Policy Analyst with Children's Health Watch, which is a national network of pediatricians and child health researchers with really the core mission and goal of improving the health and development of very young children and their families by informing policies that alleviate economic hardship. And so our work is really focused on first data collection and research, understanding the experiences that families are having. And so what we do is we collect frontline healthcare data on young children and their families accessing care in urban safety net hospitals in 4 different cities. So we're in Little Rock, we're in Minneapolis, we're in Philadelphia, where I am, in Boston at our headquarters at Boston Medical Center. And then just until recently, we were in Baltimore as well. And through our data, through our interviews with families who are in either the emergency department or who are coming in for their primary care appointments, we ask them about their experiences with food, with housing, with childcare, healthcare, and really their financial stability in general. And then we're able to look at the relationship between those hardships and health, both what they tell us about their health, but also through their electronic health records. So we get a lot of details there that we're able to take a look at in terms of health outcomes and healthcare usage. And so for that reason, because we focus on all these issues, we are a multi-issue organization. And like Alex was describing, really focusing on kind of the root causes of these health outcomes. And I would say housing, and the reason that we're involved here, housing, I think, is one of the most important determinants that we look at. You know, if you're not, we've found that if you're not stable in housing, it essentially undermines all of the other efforts. If you've ever heard rent eats first, we know that that often is the first place that families' budget goes. And from our data and the things that Chantel was outlining at the beginning, we really know that housing is health, and that it's so critical to your health, both as your environment and also the stability of your housing. In terms of our population, we focus on young kids, like I said, so kids specifically who are under 4. And so of course, this is a group that is really at a stage of critical brain development and growth. And so because of that, housing is very critical at that stage. And we see that quality, affordable homes are, as our lead principal investigator here likes to say, a prescription for good health. And so we really believe that, and have loved to engage with OSA and become part of this campaign, really for a number of reasons. But first, because of the approach of really being a multi-sector campaign and organization, understanding that housing instability and these issues aren't existing in silos, that they're interrelated to so many different experiences across different hardships, across different systems. And so I think that's a really critical piece of this campaign. And also I think the OSA vision is very consistent with our own vision in terms of being founded really on the idea that public policies are essential to children's health and to the health of the population at large, both for the good and for the bad, depending on which policies we're considering. And just the history of Children's Health Watch, we started, a group of pediatricians got together right after welfare reform was passed, because they were concerned about the impact that those policy changes would have on the bodies and brains of young children. And so we're really excited about this coalition and the work we've done specifically on this racial equity working group, because we really feel passionately that this group is going to be able to make stable housing a reality for thousands of children who really need that prescription for their health.
Thank you, Charlotte. A lot of what you all mentioned, I think, also came really forward when we had a discussion around the vision, mission, and goal statements that we'll get in just a minute. But so many of these things went into crafting the language around how we were going to make changes to our vision, mission, and goal statements. And there were so many different conversations about what language was appropriate, how we were starting to think about these issues and transform the way that we not only talk about them, but the way that we think and the way that we develop a lot of the communications that come outside of the campaign. So at a starting point, it was kind of changing the vision, mission, and goal statements, but it also branched into like a bigger conversation about the way that we use language throughout all of our publication throughout the campaign, and really taking kind of note of the way that we're speaking. I remember conversations just around just even things that we don't think twice about, and we think that, oh, is this word kind of better than this word? Are we making sure that we're engaging and speaking to, representing everyone that housing impacts, which impacts everybody, while we speak about our vision, mission, and goal statements and the conversation we were having around the work. So jumping into that question, and really just thinking about everything that everyone mentioned about the values and really the vision that your organizations all have. When I mentioned in the short presentation that we changed the vision, our new vision now says that the nation's historically marginalized households and those with the lowest income live in safe, accessible, affordable homes in neighborhoods that are free from discrimination and where everyone has equitable opportunities to thrive. And so my question to you all is, how does this fit into your own organization's vision? And I'm looking at Alex, so I'll start there.
Yeah, Chantel, one of the great opportunities of the racial equity work group was to have these discussions and really delve into like getting down on paper what we may have in our minds, but putting it in words so that it's clear and we're really targeting supports to the households and individuals that, you know, are the ones most in need of the supports, in large part based on, you know, systems of ongoing oppression. So one of the things that we took away from all this work is some really great ideas on how we could improve our writing guide principle at FRAC, and how, you know, words definitely matter. And we want to make sure, as we're looking at policies and missions, statements, and goals, that we don't continue to harm people and make them feel powerless with our word choice. You know, we really need to focus on how the structures are causing harm, and we need structural changes, and we need to be focused on language that centers people most impacted. And we need the language to provide context around the structural and systemic factors that cause housing insecurity and food insecurity and other hardships. So that was a really important takeaway from this work. And again, just the ability to break down some of the silos, because when someone comes, you know, to an organization or to the table in terms of what they need, it's not that the person only needs assistance getting food, right? It's everything is interrelated. And this is a real opportunity to try and connect those dots in terms of policy, so that we're all promoting holistic approaches to addressing poverty versus staying in our, you know, silos and just pushing for nutrition assistance or housing assistance. So that's been key to helping us address root causes.
Thanks so much, Alex. I'll turn it over to Charlotte.
Thanks. I definitely agree with everything that Alex just put out. I think engaging with this group has been really helpful in our own organization's development and kind of progress in this area. And I know we'll get into that a little bit later, but in terms of our own mission and vision, I mentioned that we focus on very young children, but to get a little bit more detailed on the population we focus on, it's a really unique group that's not typically in the public eye or really studied much, being like infants and very young children. And like I mentioned, it's a very critical time of growth and development for their health and for really the health for the rest of their lives during this stage. And so we're really focused on ensuring access to basic needs and to resources at the very beginning of life, so that all children have the opportunity to thrive. And so within that young population that we focus on, the majority of our families are families of color, and a large proportion are immigrants, and many immigrants of color as well. And so by nature, it's really not a population that's easily identified in any national data sets. And so I think we're able, having that unique perspective, speaking to those families, and we've spoken to close to 80,000 families at this point, really gives us a unique added perspective to the policy and research conversations, having the actual data behind our recommendations and what we're working on. I would say how we've kind of developed in our own vision over the past number of years, and in this vision, is we've added a number of questions to our survey that really get at experiences of discrimination, for example, at the neighborhood level, but also understanding how families interact with systems, for example, how they interact with their housing authority and how that affects their access to programs, and then their future comfort or ability to access those programs. And then in addition to our research, this cross-sectional research with families, we also have done one randomized control trial, so one pilot trial around housing prescriptions. So again, coming from the angle of what can we find out to support our policy work and to help these families really through a racial equity lens, but also through a multi-sector and multi-issue lens. So determining essentially what we did in that pilot is we paired the coordination of services for housing, for financial and legal assistance, for different health services and healthcare services, and basically looking at how that kind of suite of services supports housing at the end of the day, and the housing stability of families. And so we know that equitable access to not just housing, but the need for equitable access to all of these different resources and needs.
Thanks, Charlotte.
So I guess I'm next. And I echo what my co-panelists have said, and I'll just say that Catholic Charities agencies have always sought to add value to the communities and tended to focus on those most vulnerable. And regarding affordable housing, a large portion of our network's portfolio covers those with incomes, households with incomes below 30% of area median income. So again, this dovetails nicely with us, CCUSA and OSA. And so when we look at and I'll give you a case in point, is our latest initiative, a healthy housing initiative, where we've combined, it's a 5-year pilot to solve chronic homelessness by partnering with Catholic Charities and Catholic health systems in 5 cities: Detroit, Las Vegas, Portland, Oregon, St. Louis, and Spokane. And we've all seen studies and reports that demonstrate how minority groups in the US experience chronic homelessness at higher rates than whites, and therefore make up a disproportionate share of the homeless population. So through its healthy housing program, we work with our pilot agencies to take affirmative steps to make affordable housing opportunities and services and programs available and accessible to all, understanding that the chronically homeless population is proportionally overrepresented by African Americans and other people of color and minorities. We work with our pilot agencies to review and analyze outreach programs, activities, sensitize the staff to any cultural concerns or service gaps. And we meet regularly with our pilots to share and examine strategies and improve outcomes to address racial disparities. Our Catholic health partners have been especially helpful in centering racial equity in the work too, especially in this healthy housing pilot. First of all, our Catholic health partners, Ascension, Providence, St. Joseph, SSM, Mercy, Dignity, they're all part of a Catholic Health Association, or CHA. And CHA has its own diversity, equity, and inclusion, or DEI program that's We Are Called, and it centers and it works and it helps the hospitals center their work around racial equity to promote diversity, equity, and inclusion. And at the same time, our Catholic health members partners develop their own DEI programs, and they've openly and aggressively shared them with our Catholic Charities pilots. And it's been a really nice partnership where we're able to take some of those elements and bring them, when they bring the services, the primary healthcare services, into the permanent supportive housing projects of Catholic Charities, we still have these centered, we're centering racial equity. So we make sure that we're serving our populations properly and effectively. And the great thing is that this sharing of information has extended beyond this healthy housing pilot into other areas that Catholic Charities works in. And you know the variety of areas and work that they do. So it's been very valuable on that.
you so much, Curtis. And I just wanted to put it in here because we've had that discussion in the chat. Apologies about the captioning, and it should be available now for those who need it. So let us know if you're having any issues with that, but it should be available. And a recording will be available, and I believe there's a transcript as well. So just wanted to throw that out there since we had some discussion in the chat. And again, really, really sorry about that. Thank you all for your answers to the questions as well. And just listening to your answers, I think one thing that I can really pull out from it too is just how we're seeing it in your organizations, in particular programs, in particular discussions that's happening within the organizations, and this kind of consistency around how it has an impact on all the work and that is being done in the organizations as well. And I think that that really speaks to how an intentional work around racial equity, even in one group, can really have an impact on other work that we're doing. And that multi-sector work that we're doing throughout the campaign is also lending, some leverage in other work that's being done, as well as the expertise that you guys brought into developing a lot of the things and a lot of the actions that we were doing within the campaign. So definitely things that I mentioned around not only the vision, mission, and goal statements, but so far we do have a podcast episode. We have articles on the website. We've definitely looked to revamp, took fresh eyes to look at our policy agenda. And I think that takes a lot of accountability and also reflection. And so going into our next conversation around shifting the conversations that we were having to be more racially centered in a new framework, my question to you all would be, how has the Racial Equity Working Group adapted a racial equity framework, and how has your organizations moved towards that framework? And I'll go to Charlotte for this one.
Thanks. I'll start by saying just that what OSA has done on the Racial Equity Working Group has been a very great example for our own work. I think you've demonstrated a very clear commitment to centering racial equity in all of the work and engaging, really committing to engaging all coalition members in that and bringing in all of their different perspectives. As you kind of mentioned at the beginning, we went through all of the OSA materials, both internal and external documents with a racial equity lens, whether it be the mission or some template slide decks or issue briefs. And again, it was a very collaborative process working with the OSA leaders and partners to bring in these various equity perspectives. Just, for example, the health perspective that I bring, and then the anti-hunger perspective that Alex would bring, and as well as the faith-based community perspective that Curtis would bring. And so I think that was incredibly effective, as well as the way that the campaign has continued to not only revise past documents, but really continue to center racial equity, not as just a footnote in the issue briefs or just a blurb that you see, but really centering it and making it the focus of all of the work that we do. And so thinking about how it's been brought back to Children's Health Watch, I would say first, we really did replicate this process in terms of taking a hard look at our internal practices and our work portfolio and the ways that it would advance racial equity or racial inequities. And so I would say on the internal side, thinking about hiring processes and procurement, but then really on our work portfolio side, considering how we're thinking about this as researchers in a space where our research and the policies we're trying to inform really disproportionately affect people of color, and really also as researchers understanding the power dynamics and some of the historical trauma associated with research and how that might affect our work and our approach. And I'll say the ways that we choose which projects to work on and the policies we focus on first, and this has kind of always been the case, that they've been informed by our pediatricians and what they're really seeing in their clinics, talking to families every day, talking to their patients. And then also engaging with community-led organizations, and that feedback has been critical in guiding our work and guiding which projects and which policies are the most relevant to advancing racial equity and which do not so much. And for example, I'd say one tool that we've used, there's this racial equity scorecard that was developed by Marlisa Gamlin, who used to be in the anti-hunger world at Bread for the World. But it's really this kind of simple tool, but very powerful, thinking about both the outcomes and unintended consequences of policies, as well as equity in their design and equity in their evaluation. And so we use that to really go through all of our policy priorities and identify what are the things we've been promoting with, the best of intentions, but that have actually had harm built into them. And so this kind of upended our prioritization of the solutions that we've been trying to advance, and also specifically the questions that we're trying to answer in our research, really trying to ensure that the policies that we're continuing to support are not policies that may do harm, or even policies that just maintain current racial inequities, but really are ones that can advance racial equity and just disrupt that. I would say in some of our publications, like our policy briefs, we've definitely had a very intentional racial equity focus, as well as being in the research and academic space. We do have a number of publications, including one with Chantel and Mike and Diane and other members of the coalition around housing with a very strong racial equity lens. And so we've been embarking on that journey, and I think really trying to take these lessons learned from OSA of how to continue that work throughout.
Thanks, Charlotte. I'll turn it over to Curtis.
Thanks, Chantel. In my view, I think the OSA Racial Equity Working Group adapted the racial equity framework by reviewing the mission, as you said, and the vision, and considering how disparities negatively impact, people of color in many sectors. And I think as Charlotte laid out, we took the perspectives and opinions and comments and concepts from each other and wrestled with them and really dug into it, words and phrases. And I thought that was very meaningful and deliberate. As a multi-sector campaign for fair and equal affordable housing, racial equity needs to be centered in the campaign, and not just in terms of housing, but in all sectors. And I'll use health and housing as an example. I mean, we've seen the data that proves the disparities in not just housing, but in health outcomes for people of color like African Americans, and it demonstrates how they're overrepresented. And we've seen it in homeless populations and chronically homeless, as I said before. So, policies and procedures, we were very concentrating on making sure they're more than simply, for us anyway, not trying to run afoul of fair housing regulations, but more focused on how can we increase the quality of service that we deliver to unrepresented populations, and how can we improve outcomes. And I'll tell you, we've taken some things back to CCUSA and even shared them in throughout our network. In CCUSA's policy paper, Poverty and Racism, Overlapping Threats to the Common Good, we looked at that again and made the message clear that racism and discrimination in all forms can't be tolerated. At our 2021 annual gathering, we had Reverend Brian Massengill, an African-American priest, delivered a powerful call to action about centering racial equity in the network. And he noted that any strategy to reduce poverty in America must also confront the deep connection between racism and poverty. And we hold ourselves up to be attackers of poverty, reduce poverty for those most vulnerable. And poverty and racism are so intertwined that it's impossible to fully separate them. So therefore, as he said, we can't really effectively attack poverty without attacking racism. So I'd say also that even if racism, even if it's individual and institutional forms, it's a cause of poverty. And at the same time, an additional barrier for people of color who are seeking to escape it. Now, in my area of responsibility, at Catholic Charities USA is in housing strategy. I'm an affordable housing professional, but part of the strategy was to engage the Opportunity Starts at Home campaign to increase collaborators, supporters, and the voices and advocates for more targeted resources for affordable housing. And so having expanded my neighborhood vis-a-vis my network, vis-a-vis CCUSA and meeting Charlotte and Alex and everyone else in the network has just broadened our approach. And this came from, working with the campaign to do that. And serving those most vulnerable includes, making sure that you touch many aspects of their lives. I mean, I'm a houser, so I've learned from my co-workers and colleagues at CCUSA about the social determinants of health and understanding that. And I'm a true believer that housing is foundational to that. And so having this framework and being a model of centering racial equity improves outcomes has been valuable for us at Catholic Charities USA. And we continue to work with it and bring those lessons learned from OSA to our network and its improved operations.
And just echoing the theme of how this work has really had benefits to the work we do day in and day out on food insecurity. One thing that we started the OSA work with is the inextricable links between housing and food insecurity. So, you on this webinar know well that if people have to pay more of their money for housing, then there's less money to pay for food. And people have to make excruciating choices. And as Charlotte mentioned, often the rent eats first. So people shouldn't be faced in our country with deciding, do I pay for my housing cost or do I pay for my food cost, the food I need to feed my family? We also knew that housing affects other issues that fuel or exacerbate food insecurity. So where do you live? Do you have access to a full service grocery store? Do you have to spend money or barter a ride or take precious time if you do have public transportation to get to a store that has a wide variety of food items at affordable high prices? Your housing determines whether you have summer enrichment activities for your kids in your neighborhood and if those sites are participating in the summer meal program. It also determines whether you have places to safely store and prepare your food. And we know that due to community disinvestments, many of the same families that are struggling with food insecurity are also struggling with housing insecurity, and that they're paying a poverty tax of sorts, where basic services like banking and retail and pharmacies, they're just lacking in the community, or they're offered, but the choices are very slim or the prices are exacerbated. So housing and food insecurity go hand in hand. One thing we've been really forced to confront is how racial inequities permeate poverty, housing insecurity, food insecurity, and that's a common factor that's driving all of this social injustice, and that we really have to figure out what are we going to do to close some of these gaps and who's experiencing these deep societal problems. And part of that is really looking at how we address the systemic and systematic systems of oppression that have been created by people. They didn't exist. They're a political outgrowth, and we really have to figure out ways to address those if we're really going to end housing insecurity and food insecurity. So this has been a really interesting point that we've talked about and really figured out, like, okay, just because this policy helps low income people, is it really getting at those racial inequities? And I'm still, figuring all this out, but I feel like this work has helped me make a little step forward, and I'm really appreciative to OSHA for that.
Thank you. I mean, what was really echoed through, I think a lot of the answers here is just how that we talk about the spillover impacts, but really seeing that spoken about in ways that are even being seen in the work that you all do. So there's so many ways and so many different areas that were mentioned, just thinking about the ways that we're trying to address the issues presented here. And we see, again, that spillover impact is just something that's almost kind of embedded, right, in everything. So definitely was echoed in hearing a lot of what everyone was talking about. And just thinking again back to the work that we were doing, and when we started the work too, I think even throughout the work, what has been helpful too is looking at other organizations and the information that they've produced and put out there too, to help us also think about some of these concepts and the way that we can change them and bring it into our work too. So just that kind of sharing of knowledge, I think, has also been helpful too, in terms of the way that we were thinking about the framework and that as well. So we have all the expertise of those that have been on the racial working group, but even coming into it, I think that we also did a bit of just like, oh, I've seen this resource here and I've seen this resource there. And that was also very, very helpful as well. So that's something that kind of just popped in my mind as everyone was speaking as well. To our next question, which kind of goes into the takeaways that I was kind of just talking about, is a takeaway. So what are some of the key takeaways from being part of the process of forming the Opportunity Starts at Home Racial Equity Working Group and our work thus far? And I'll turn it over to Alex.
Yeah, well, one thing I don't think we've discussed adequately is the need to engage people with lived experiences and expertise in housing insecurity, poverty, food insecurity. And, that's much broader than the racial equity focus, because, it's people across, races and ethnicities who've experienced food insecurity and housing insecurity. But that's a really important piece in doing this work better. And, if we're looking at racial equity, then definitely, hearing from people who, me as a white woman, I mean, I don't know what it feels like to be discriminated against. I'm half Colombian, but I haven't faced discrimination based on my race or my ethnicity. So really, not just, hearing from people, but really figuring out ways that they are engaged in developing the policies and, tweaking the policies and implementing the policies is something that's really important to move this work forward. And FRAC and Feeding America each year have an national anti-hunger policy conference. And one of the things we did this year that was, as part of our work to improve equity, particularly racial equity in the disproportionate rates of who experiences hunger in America, was to center the conference themes on how are you working to address racial equity and who goes hungry in America, and then how are you lifting up and engaging people with lived expertise. So that was a really important piece of the conference this year, and we also had people submit workshop proposals and select workshops. And we had an incredible housing advocate out of Washington State and Chantel's panel that really, it was so important to hear the perspective of what's happening to the people impacted by these policies. Because we can't just, lock ourselves up, although we can during COVID, but we need to really, conduct outreach and make sure we're hearing from the people who are experiencing these issues.
Yeah, I'll jump in there. I think we've definitely had the same lessons learned. And I think how we've been engaged with community-led groups and people with lived experience on our policy priorities and in our publications, or when we've been developing, some of these has been really, really impactful, not surprisingly, but in terms of really just guiding what we thought. We started with a draft of what we thought, and again, coming in as a white woman and a team of, many white researchers of not having that perspective, obviously, and really, being able to listen and not just stick with the recommendations that we initially thought. And I think to see the way that those have developed and how they've really, really changed over the past few years has been great. And I think in terms of OSA and the takeaways from just the coalition in general, I'd reiterate the importance of multi-sector partnerships, not just to bring in the other perspectives and love your point, Chantel, earlier about, the learning that we had from each other, since we all can't be experts in all of these areas. But I think also just in the power of engaging with policymakers and different groups. For example, you might have somebody in a leadership position or somebody who's your city or your state's congressman or senator, and they're really passionate about, or not particularly housing, but they're passionate about, childhood asthma, or they're passionate about food insecurity or something like that. And they don't have that direct connection in their mind necessarily with housing and with housing policy. And so I think having all of these different folks engaged in the same coalition and being able to bring in that perspective and really kind of just make that shift for some of the policymakers that we've spoken to, that's been something that I've noticed in those conversations has been really helpful. And then I just say also just that the work is so continuous, and OSA has been very adamant on continuing to evaluate all of its processes and what the work they're doing and kind of the focus that we're going towards, and really appreciative of that.
I'll say this. My key takeaways, I really had 3 key ones. I'll say intentionality, sharing information, and knowing and acknowledging history. And so I think we've already said, and I heard you say it, Chantel, intentional. Keeping racial justice centered requires intentional and affirmative efforts to do just that. You've got to do it, you've got to push it forward, and then you've got to dig into it. It means being willing to have conversations and discussions that make some uncomfortable, but a desire to push for actions and steps for racial justice and healing and equity that we can really do in realistic time and implement right away. And for me, the Racial Equity Working Group engaged in a process that took me way beyond, as I said before, simple fair housing compliance, because that's really the minimum standard my small group at CCUSA has to focus on when they're being housing providers. And so we wanted to step well beyond that. I think we've said it, but it can't be said enough, is sharing information. OSA has been very good about sharing information to us, and I've just poured it out to my network, and they've shared it and reshared it. And sharing information required an honest discussion and feedback that made it clear that this information sharing is information is power. We know that, and sharing is powerful. I'll say that. And as we work to center racial equity in our work at CCUSA with our local agencies and offices, we've been willing to share information, successes, and acknowledge our failures and work towards diversity, equity, and inclusion. And for me, the real key, I think OSA and the staff is to be saluted for this. You've really been helpful. We can't allow history to be distorted, suppressed, forgotten, because it helps us understand how we are here today and where we are. And I'll tell you, this whole racial equity working group and the OSA staff were very, laser-like focused on including history to help evidence where we are today. And I think your recent blog was a huge reflection of the work that you did to bring, tell the story and bring out some of the steps and the reasons why we're here and where we are. And it helps you, I think, map out strategies and actions that are effective for getting us to racial equity. So, and I'll just conclude by saying racial equity and centering that into your work is not a one-time thing you do and you're done. It's something that evolves. We've got to purposefully do it. We've got to promote it ongoing on a regular basis, and you've got to be committed. And once you do it, you got to keep doing it.
Thank you all. I mean, what's echoing in my mind is just the persistence that needs to be done, that needs to stay with the work. And another thing that I was thinking about just as you all were speaking was just acknowledging the challenges. Like this has not come without challenges. I mean, we spent a long time trying to change the language that we were using on the vision, mission, and goal statements, just to make sure, just to think about like, how are we being inclusive? Are we being harmful? Is the language harmful in any way, or anything like that? I mean, we've been having continuous discussions about who's at the table at the campaign, and like, what does that look like? What are we even talking about here? How do we transform that? What is the conversation? And so this work is not being done without any challenges. If anything, I think it's going through the challenges and really trying to get to the solutions and the other side of that make the campaign a lot better. So I just definitely want to echo that, and echo even some of the things that we even mention or talk about, even when we're putting information and language out there about even the limitations that we've seen in the campaign as well. So there's definitely challenges in the work. And I think that what it has been is like working through those challenges to find how we get to that other side, because we found that a lot of these conversations can be hard to have, but needed, very much needed to have. And so throwing that out there, because that's a major takeaway that I also want to share with everyone out there also looking to do this work as well. And so I'll come upon, we have a few minutes left. One question that I'll throw out there to you all is just about, what are you excited about in this moment? And what are you hopeful for as we're making these changes to the campaign? And I'll go to Charlotte.
I would say what I'm excited about in this moment, just to back to our own sector, the health sector, is just the way that we've seen the drumbeat around housing and health just get so much louder and louder over the past 5 years, 10 years. And I think in particular, the way that health systems are engaging with the work more, realizing that health outcomes are not, and good health outcomes aren't achievable through healthcare alone, really need to take into account all these different determinants of health, particularly housing. And so I'm excited by the continued interest that we're seeing in engaging with this work and supporting it, not only on a programmatic direct service level at the hospitals, but really at a policy and policy advocacy level.
Alex?
Thanks for the question. I thought of so many things I was depressed about. So this was the hardest question to answer. But I did find something that I'm very excited about, which was just announced today. So the last White House conference on hunger, nutrition, and health was more than 50 years ago. And today the White House just announced they are having a conference to develop a blueprint to end hunger and improve nutrition by 2030. The conference will be taking place in September, but there'll be lots of opportunities in leading up to the conference to get people engaged. There'll be listening sessions. There'll be a website where you can put in ideas and strategies to end hunger in America. We're really hopeful that folks on this webinar and who are part of the housing movement will engage, because obviously, you know, if we're going to end hunger in America, we have to promote housing. So I know we'll be working with Chantel and the rest of the OSHA, that doesn't quite roll off your tongue. Opportunity Starts at Home campaign to lift up engagement opportunities and really make sure that the conference, you know, has bold policy ideas that advance racial equity. And they definitely said that one of the key measures of success for the conference is centering the work on addressing racial equity.
Thanks, Alex. Curtis?
I'll say this, I'm excited because I'm seeing some things happen in our network that I'm not sure would have happened before these conversations. And I'll give you one example. Most recently, a service center that provides services for homeless folks and the community at large in Detroit, they provide dental services and case management. Well, what they did was they partnered with the local Black Catholic ministry there, and they had Catholic Charities commissioned a mural of 6 or 7 candidates, African-American candidates, that are being considered for sainthood. And what that did was it brought the whole community out, and they kind of engaged and started, it just built up more of a community engagement thing. So it's not really a policy, but it was an action that occurred. And I think they're seeing dividends from that. Our member agency in Oregon took a look at some of their procedures when they were looking at one of their homeless service centers and saying, boy, we're underrepresented. And what they did was start taking a look and found out by having meetings at different places, different times, and bringing different staff into it, they were able to close some cultural gaps, and they've increased minority participation and inclusion at one of their centers. So I think we're starting to see things happen because we're pushing this initiative forward. So I'm excited by that.
Thank you so much. I kind of want to jump off of kind of where you left off there, Curtis, because we did get a question that I think could be helpful too. And if anyone else had some feedback on this would be great. And it's really about hiring and processes moving forward, like RFPs, applications, things like that. And how are we thinking about tweaking or transforming those systems too that really advance racial equity? I can say on the campaign's perspective, one way in which that did show up was through our grants for our state grants, and making sure that we're asking those kind of questions when we're assessing. It was, we have a number of things that we consider, but that definitely was a criteria that we used to consider how we were going to give those funds out. So that's one example through the campaign. And I'll just open it up if there's any other examples of that as we're answering some of the questions here.
Yeah, FRAC's been doing regranting to state anti-hunger groups. And, part of that regranting is a criteria to make sure the sector is more diverse. So that's, a plus in terms of getting funding. Another thing is we launched a racial equity fund and gave out grants to organizations and tried to make the process, not a full-time job for 3 weeks for someone to apply for a grant. We really tried to streamline it so we would capture the information we needed. And another way was for the FRAC Feeding America conference, just having workshop proposals and having as a criteria, having someone on the panel who brings diversity to the panel or lived expertise. So those are some ways that are, not necessarily transformational, but they're moving in the right direction.
Yeah, and I'll add, in addition to some of the hiring practices, I think we've been focusing a lot on our procurement in terms of, who are we engaging, what vendors are we engaging with for when we have events and have catering, for example, or when we need a video made and we need to work with graphic designers or something like that, really making sure that we put our money where our mouth is and understand who we're supporting in the community and where that's going.
I agree with all of that. I mean, I know that there's been trainings and workshops with diocesan directors at CCUSA on diversifying their training and trying to get the staff to look like the people they serve. And CCUSA itself has done a good job at a diverse hiring. So I agree with all of those things. And plus just taking a look at how you can get your programming out to more people in more effective ways. And I think Alex said it perfectly, bringing in that lived experience, that's really been valuable for us, not just at CCSA, but specifically when you're developing housing and you bring in lived experience for whatever type you're bringing in, it draws it in. And often that in and of itself brings in a racial equity component with it. So.
Thank you so much. I want to thank the panelists for joining us today. I want to thank you all for joining us today. I hope that this discussion was really helpful. And if there's any way that you need to contact us just in case there was some materials or resources that you wanted to just get more information about. Please let us know. We'll definitely have that available, as well as a recording available after this event today as well. Again, thank you so much for joining us. Thank you to our panelists, and we hope that everyone enjoys the rest of the evening. Thank you.
Thanks, Chantel, for
Thank
hosting
you.
us.
Great job.
Great
Thank
job
you.
facilitating.
Thanks.
Bye-bye.